How's everybody doing today? I've had a lot on my mind for a while. And, you know, you always like to talk to people, talk to someone. You always got somebody to talk to, so I decided to start making, I guess, like a video diary. And just talk about what's on my mind. It is September the 22nd, 2025. There's a lot in the world going on today, but something that really has been bothering me for a while, not just current events, is healthcare. Healthcare in America. I speak on this because I am a nurse. I've been a nurse almost 15 years. Mainly worked in nursing homes, worked in hospitals for a couple of years. But just the gradual decline in healthcare. From insurances, making it so complicated to get prescriptions. If somebody has the correct diagnosis or not wanting to cover medication because of their age. They don't say that specifically, but the loopholes that they put in prior authorizations with medications from nursing homes, hospitals, if it's a really expensive drug, all the little loopholes they can technically go through to say, we could treat with this and it's just as good. It's just crazy. It really is. It's really we've got to the point in the world where we're putting people's lives over money, and we're charging so much money for medications. I can think of a medication that they use to treat people that have chronic liver failure, Xifaxan. That pill is about $2,000 a month. It's also an antibiotic if you look it up to treat traveler's disease, diarrhea from drinking bad water in other countries. But they use it a lot with people that have high ammonia levels. In Europe and stuff, man, that pill is like $150. It don't make no sense. It makes no sense in America how our healthcare is. It's so money driven. And in nursing homes, man, when I first started working in nursing homes, I was really blessed. The nursing home I worked at was family owned, big facility. I was over 250 people in that nursing home. It was literally like its own little village. The doctor that was there grew up in the county. Most of the nurse practitioner stuff was from the area. So not necessarily they knew everybody, but they knew people's families and they cared. I literally seen the doctor, and this doctor was in his 60s, crawl in the floor and look at patients that had failed or something had happened. And you don't see that nowadays with doctors. You're lucky to see a doctor. They have robots that can wheel in on a video and look at a patient in a nursing home. Now, mind you, most people have a little bit of dementia. So here comes a robot in there. I say a robot. It's not like got arms and stuff. It's just a little cart that goes in and telehealth, because that got big with COVID. Well, now that can count as a doctor's visit. A doctor being on an iPad looking at a patient can count as a doctor's visit, and the insurance gets billed a doctor's visit and the person wasn't physically in the room. That's just not right. But there's a lot of things that's not right. And man, as you get older, in my early 50s, you just start thinking about things and you see how the digression of healthcare and life is for the elderly. It's not right. They deserve a little bit more. I know everything can't be, peaches and cream, but medications and stuff. And when I say the treatment, not bad, but like in nursing homes, and it's legal. It's legal to have two people in a room that is roughly, say 12, 14 foot by 20 foot. You divide that by 2, that's 6 by 20, 8 by 20. It's like a jail cell. And I say that, I have done time in jail. I'm not bragging. I had to do 20 days when I was younger for being stupid. But, and then, like in nursing homes, they want to say, oh, we got to treat it like it's their home. They can do what they know they can't. I mean, they're told when they can take a shower. They're told when they can come out and eat. I mean, the digression of life for people is just awful. And how do you change it? I don't know, man. I wish I could. I wish I had the means to open up a nursing home and try to, or buy one. And I mean, you got people in there that's older, that life has happened. You got people in there that's younger that had accidents, and that's what people don't realize in healthcare. People look at nursing homes and think, oh, it's old folk home. And I did when I was a kid. You just don't have a grasp of life until you've lived life a little. And I'm not saying in your 20s or 30s. It takes to your 40s or 50s before you really start getting a good look at things. That being said, I wish people could tell their senators, congressmen, to really look at nursing homes and hospital. All healthcare. It needs reform. And when I say reform, you don't need the people that's done doing it because they just, you need a completely different look at it. Not outside the park. You need somebody that's not even playing it, not even really hardly been in the game. Because it's just got so money driven. Corporations, everybody buying it, and you have people that own 100 nursing homes. Well, they just do that so they can coop everything together to order more supplies to get a cheaper rate, and they don't. People get a crappy meal. And then, you want a snack. Well, for the rest of your life, your choice is oatmeal cream pies, cheese and crackers, bologna or turkey sandwich, occasionally a PB&J. And I've complained about this. I used to be in management. I wasn't a good person to be in management because I was always, I guess you would say, the black sheep, because I looked at, and I'm not perfect, but I tried to think about the patients. And and you can say they do. And you can sit down and meet with them and they will put on the show that they do. They will, they'll cater a dinner in and tell you and show you how great they are. That's for a few hours. See them for a few days. And they can come in and do audits, but there's such a show put on for an audit. That's not a normal, when the state or CMS is in a facility, I would bet $100 to a penny that the staff working there is 3 times a normal day. And that's just it. You almost have to send someone in undercover. But I don't know if you can do that. I don't know all the legalities of that. I'm not a lawyer. But it's just, and I'm not saying there's bad people, by no means. It's just, it's just got so pathetic. Healthcare is so pathetic. And people just deserve more. You go to the hospital, you're sick. It's amazing to me how, don't get me wrong, they treat what's going on. But while you're there, you could be having an issue that you've had for a minute. And you bring that up. Well, they just tell you need to follow up your PCP. I remember when I was a kid, when you went to a hospital, man, they did a workup. And they just didn't treat what was going on at that time. They looked, if they found something else, they worked on that. It's kind of like working on a car. If you go in for an oil change and you see you got an O2 sensor bad or something, you go ahead and fix that while you're in there. Kill 2 birds with 1 stone. It's not like that no more, man. In the hospital, it's you got another, what about this? Well, we'll set you up to see a specialist. Everybody's a specialist no more. Used to, when you went to the doctor, we went to the hospital, that doctor kind of did everything, Then it got to where you had a cardiologist, you had a heart specialist. And now there's a specialist for everything. You can't, I don't know, man. The world is just And you say, oh, you're just old, you're just crazy. No, you just see it as you get older. Because I remember when I was a kid and the older generation talking about how much things have changed, and I just thought they was old and crazy. They're not necessarily old and crazy. They've just lived it, seen how things was, seen how things are, and seen either the progression or the digression of things. What to do? I don't know. I mean, you know, there's been a CMS, which is Medicare and Medicaid, has been involved for years. And I mean, they do their audits, they have their paperwork. And I mean, I've seen so many places that, you know, they get these awards. And some of the qualifications for the awards is you just have to have your paperwork tidy. It doesn't necessarily have anything to do with the direct care that you give to patients. And I don't know, it's just like a facade. I mean, and there's more changes we need in the world. I mean, I'm not going to get into everything in one day. This is just what has really been put on me to talk about today. Like I said, I mean, I'm nobody special. I've just decided just to sit down and kind of go over what's bothering me for that day or that moment. I mean, and let people know, I mean, that healthcare needs reformed. And people always said that, and people, you know, have been up in arms for a while, you know, not just with vaccines, not just with, and this has nothing to do with people in general. I mean, we don't have a lot of, when I say American people, I don't mean like people from America, because I don't know everybody's citizenship. But I don't see a lot of people like from areas getting into medicine and going to work in their areas. You know, used to, you had this doctor was a doctor, their kid went to be a doctor. And I mean, you've just seen, I guess, a regression of people just, I don't know, not wanting to do it, because I know it's a very difficult field. It's very expensive. I mean, the lineage, I guess is the way to put that. You know, I mean, I grew up in the country. I mean, there's just people, this family, their family was doctors, their family was lawyers, their family was farmers. I mean, the lineage and things is just different. But how can people make a difference? I guess you just complain. I mean, but I don't know. I mean, and this is the best way I can think to complain, because, you know, it's not like I can sit down and call people. So I just thought I'd make a video and, you know, tell people it's not right. Nobody might see this, I don't know. But the more that people know, the better off life is. And some people might not even realize it. Some people might think that hospitals and nursing homes, you know, are great. And I'm not saying they're not. And I'm not saying that everyone is bad. And I'm not saying everyone is good. I'm saying healthcare needs reformed. And from nursing homes to hospitals, from how we think about people. I mean, people just deserve better. And I'm not saying they deserve filet mignon every night. By no means. It's just people deserve better. And you have to start somewhere. And this is my first start at anything. Giving my opinion and making a video. I'm not a professional at either of them. But this is just something that I wanted to start doing. Like I said, I might not get one view on this. I might get 100. I don't know. But it's just something that I wanted to do. Because you can kind of leave a documentation of life. Because one of these days I'm going to not be here. And I could accidentally say something that's kind of smart or needed to be remembered, or I don't know. It's just something I want to do, and I'm going to do it. Anyway, man, if you listen to this, man, I appreciate it. I wish the best for you. Pray for yourself, pray for your family, pray for our country, pray for everyone. Because we definitely need it. And I hope everybody has a good day, and God bless.